So now we're talking about the next artery right here before us, which we are going to talk about its anatomy. This is the Profunda femoris artery. Have a lot of arteries here, but if you calm down, you could actually pick up the Profunda femoris artery. So it's also called the deep artery of the thigh. Okay, so let's look for it. So you can see here it's labeled as deep artery of the thigh. It's also called the Profunda femoris artery. Alright, so we said that what's the origin usually arises from the femoral artery, about 3 to 4 centimeters below the inguinal ligament in the femoral triangle. So what's the cause? It runs posteriorly and lateral to the femoral artery. So it descends between the adductor longus and the adductor magnus muscles. That's basically if we're having a picture where all the muscles and the arteries are being indicated. Okay, so coming here, this is a Profunda femoris, also known as a deep artery of the thigh. So branches gives rise to what? The medial circumflex femoral artery. This is a medial circumflex femoral artery. Okay, lateral circumflex femoral artery, ascending branch, transverse branch. You can pause to observe the branches there. So the lateral circumflex femoral artery, you have the perforating arteries, you have the muscular branches, then we have the nutrient artery of the femur. So moving, we see that relations, it lies deep to the femoral artery and the femoral vein, runs between the adductor longus and the adductor magnus. So we learn about the anatomy of this artery because it is the main blood supply to the thigh, and it's involved in femoral fractures, and it forms collateral supply there, if you understand, and surgical relevance. Of course, if you want to do any surgeries there, you have to be careful because the artery runs along there.